Well, welcome to today's session. Today's session is on dengue fever. So let's begin. Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. So it's mild. So if it's mild, it causes a high fever and flu-like symptoms. There's also a severe form of dengue fever called dengue hemorrhagic fever, which can cause serious bleeding, a sudden drop in blood pressure, and death. Millions of these cases of dengue fever occur worldwide each year. It's most common, however, in Southeast Asia, the Western Pacific Islands, Latin America, and Africa. The disease has been spreading to new areas, including local outbreaks in the UK and the other parts of the Western world. Europe and other parts of the Western world. Researchers are currently working on the dengue fever vaccines. For now, in areas where dengue fever is common, the best ways for infection to prevent it is to avoid being bitten by mosquitoes and to take steps to reduce the local mosquito population. So, have dengue fever, many people experience no signs or symptoms of a dengue infection. When you do it, it can be mistaken for other illnesses such as flu, and it usually begins 4 to 10 days after you're bitten by an infected mosquito. So you get a high fever of around 104 Fahrenheit, 40 degrees Celsius, and all these symptoms as seen below. So headache, muscle, bone or joint pain, nausea, vomiting, pain behind the eyes, swollen glands, and lash. So most people recover for a week or so. In some cases, symptoms can worsen and become life-threatening. This, as I said before, this is known as severe dengue hemorrhagic fever or dengue shock syndrome. So what happens with that is when your blood vessels become damaged and leaky, and the number of platelets in your bloodstreams drop. So these platelets are the clot-forming cells, and this leads to short internal bleeding, organ failure, and even death. So warning signs of dengue fever can develop quite quickly. The warning signs usually begin the first day or two after your fever goes away and can include severe stomach pain, persistent vomiting, bleeding from your gums or nose, blood in your urine, stools or vomit, bleeding under the skin, which can look like bruising, difficult or rapid breathing, fatigue, irritability or restlessness. So dengue fever is caused by any one of 4 types of dengue viruses. You can't get dengue fever from being around an infected person. Instead, dengue fever is spread through mosquito bites. The 2 types of mosquitoes that most often spread the dengue viruses are common both in and around the human lodgings. When a mosquito bites a person infected with a dengue virus, the virus enters the mosquito. Then when the infected mosquito bites another person, the virus enters the bloodstream and causes an infection. After you recover from dengue fever, you have long-term immunity to the type of virus that infected you, but not to the other 3 dengue virus fever types. So this means you can be infected again in the future by one of the other 3 virus types. So your risk of developing severe dengue fever increases if you get dengue fever a second, third or 4th time. You also have a greater risk of developing dengue fever or a more severe form of disease if you live or travel in tropical areas. So being in these tropical subtropical areas increases your risk of exposure to the virus that causes dengue fever, especially high risk areas that include Southeast Asia, Western Pacific Islands, Latin America and Africa. You have had dengue fever in the past, so previous infection with dengue fever increases your risk of severe symptoms if you get dengue fever again. Fundamentally, when you get dengue fever, you do need to be careful with complications. So if you have a severe one, you can end up with internal bleeding and organ damage. Your blood pressure can drop to dangerously low levels, causing shock, and in some cases, it lead to death. It's also quite dangerous for females who get dengue fever during pregnancy, as they are able to spread the virus to the child during childbirth. As well as that, babies of women who get dengue fever during pregnancy have a higher risk of preterm birth, low weight, or fetal distress. So prevention. So the World Health Organization has stated that the vaccine is not an effective tool on its own to reduce dengue fever in areas where the illness is common. This is areas like Southeast Asia, Western Pacific Islands, etc. So preventing mosquito bites and controlling the mosquito population are still the main methods for preventing the spread of dengue fever. So if you live or travel to an area where dengue fever is common, the following tips on the screen below will be able to help you. So stay in air-conditioned or well-screened housing. So mosquitoes that carry the dengue viruses are most active from dawn to dusk. I don't mean the sun, dawn to dusk. They can also bite at night. Wear protective clothing when you go into mosquito-infested areas. Wear a long-sleeve shirt, long pants, socks and shoes. Permethrin can be applied to your clothing, shoes, camping gear and bed netting. You can also buy clothing made with permethrin in it. For your skin, use a repellent containing at least 10% concentration of DEET. Reduce the mosquito habitat. The mosquitoes that carry the dengue virus typically live in and around the houses, breathing in standing water that is collected in such things or used automobile tyres. You can help lower mosquito populations by eliminating habitats where they lay their eggs. At least once a week, empty and clean containers that hold standing water, such as planting containers, animal dishes, and flower vases. Keep standing water containers covered between cleanings. Diagnosing dengue fever can be difficult because its signs and symptoms can easily be confused with those of other diseases such as chikungunya virus, Zika virus, malaria, and typhoid fever. Doctors may also draw a sample of blood to be tested in a lab for evidence of infection with one of the dengue viruses. Clinical laboratory findings of dengue fever include low levels of white blood cells and platelets and an often elevated level of the enzyme serum aminotransferase. So if anyone can recall, that is AST, the liver enzyme. There is no specific treatment for dengue fever which exists, but there are medicines which are available. And if you have severe dengue fever, you might need supportive care in a hospital, intravenous fluid and electrolyte replacement for your fluid losses, your sodium potassium ions, blood pressure monitoring, and transfusion in place of blood loss. So looking at the medicines a wee bit, so you can have the over-the-counter drug known as acetaminophen, brand name Tylenol, which can help reduce muscle pain and fever. But importantly, if you do have dengue fever, you should definitely avoid aspirin, ibuprofen, all those brands, and the sodium naproxen sodium, the Aleve brand, as these pain relievers can increase the risk of dengue fever breathing complications. That's the end of today's video. So I hope you've had fun today, and I look forward to seeing you next one. Thank you. Bye bye.